Hi, I'm Simon Harrison. I'm from Peter MacCallum Cancer Centre and Royal Melbourne Hospital in Melbourne, Australia. I'm going to talk to you today about a phase 1 first-in-human study of AMG 701, which is a BCMA-directed BiTE molecule used in patients with relapsed and refractory myeloma. So BiTEs are interesting molecules. They're a fusion between a molecule that recognizes T cells through the CD3 receptor, and also an antigen on the surface of tumor cells, in this case BCMA, on the surface of the myeloma cells. And these molecules are fused together so that the T cells can come into close proximity of the myeloma cells and then initiate T cell activation and T cell mediated killing. Usually these molecules are pretty small and need to be given by continuous infusion, but in this case, an additional protein was attached to increase the half-life of the molecule to enable it to be given once a week. Patients usually appreciate intermittent dosing rather than being attached to a pump all the time. The patients who were included in this study were patients who'd had previous treatment for myeloma and had to have at least 3 previous treatments, including a proteasome inhibitor, an IMiD such as Revlimid, and an anti-CD38 antibody such as daratumumab. Patients with non-secretory disease couldn't enter the study, and patients who'd had an autotransplant needed to wait 3 months after treatment, and an allotransplant needed to wait 6 months before they could start on study treatment. Patients who'd had previous therapy directed at BCMA were also excluded from the study. The treatment was given once a week by an IV infusion until disease progression, and pre-medications were given in the first couple of cycles using dexamethasone. And we'll talk about step dosing later. So we started off with very small microdosing and went up the dose escalation until we reached 1.6 milligrams. And then cytokine release syndrome, which is a way in which the body reacts to tumors via bispecific antibodies or CAR T cells, where a lot of chemicals are produced by the immune system to try and fight off the tumor in similar way to which infections are fought off. The dose was then reduced to 1.2 milligrams as the target dose, and smaller doses were given in a lead-up fashion called step dosing to try and reduce the impact of cytokine release syndrome. And this has allowed the dose to be escalated up to 12 and 18 milligrams, and they're the current doses that are being explored in the study to date. This gives you a snapshot of the type of patients who were included in the study, and they're very relatively advanced stage patients, with a lot of patients with extramedullary disease, lots of previous lines of therapy with an average of 6. Most patients had had a transplant, and the majority of patients were exposed to both proteasome inhibitor, IMiD, and anti-CD38 antibody, and 62% were refractory to all of these classes of drugs. 85 patients have been accrued to the study to date. 64 have stopped treatment, most because of progressive disease and a few because of adverse events, and we'll talk about those in a moment. And 21 patients continue on study treatment at the time the study report was constructed, with a median time on study of 7.6 weeks. This is the adverse event profile. So a number of patients experienced cytokine release syndrome. Most of this was grade 1, but a small number of patients had grade 3 cytokine release syndrome, and this was characterized by increases in liver function tests on blood testing, and some patients were hypoxic. All of these adverse events were rapidly reversed with a combination of steroids and or tocilizumab, which is the standard treatment for cytokine release syndrome. The other major toxicities that we saw were grade 3 atrial fibrillation, grade 3 acidosis, and a grade 4 thrombocytopenia. And the rest of the toxicity profile is summarized here, but relatively well tolerated for this kind of treatment. About 42% of patients developed anemia, 25% had neutropenia, 21% thrombocytopenia across all grades. And apart from cytokine release syndrome, 65% of patients had, which is 65% of patients had this, diarrhea 31%, and hypophosphatemia in the blood was noted in 31% of patients. There have been 4 deaths on study, all in the context of progressive disease, 2 due to infection, and 2 due to bleeding. You can see here that the response rate has increased as we've gone up the dose escalation. Overall, 26% of patients have responded. Only 1 patient has responded below 3 milligrams, and we'll talk about that patient in a moment. Overall, in above 3 milligrams, 36% of patients have had a response, with 24% having more than a VGPR. In the most recent evaluable cohort, 83% have responded, or 5 out of 6 patients, and half of them have had a VGPR or better. Patients have been tested for MRD, and 6 out of 7 of those tested have achieved MRD, as shown on this study. And all 6 have ongoing responses, and these have lasted up to 22 months. Here we can see the Swimlane plots, which show you how long patients have been on study and how their responses have deepened over time with continuing drug exposure. The patient treated at 0.8 milligrams was treated at our center. She's a very illustrative case of a patient heavily pretreated, having had 13 prior lines of therapy, including an autograft and an allograft. She was bridged onto the study, having an autograft to debulk her, and then went on to study treatment and has had a prompt and very deep response, which is ongoing for over 26 months and is tolerating treatment really well. Here we can see the level of AMG 701 in the blood after the target dose has been given. And you can see it increases as the dose escalation goes up. So this is relatively predictable. And also the drug lasts long enough in the blood, this is known as the half-life, to allow the dose to be administered once a week. BCMA is shed into the blood, and this is one of the determinant factors that allows us to, that's predicting free drug exposure to try and bind onto the myeloma cells. So in conclusion, AMG 701 is a half-life extended BCMA targeted BiTE molecule, which was explored in patients with heavily pretreated relapsed refractory multiple myeloma. It has a pretty manageable safety profile, with all grade 3 CRS events being reversible within a couple of days. And half of these were due to transient increases in liver function tests on blood testing. It has a really encouraging level of activity with responses lasting up to 26 months. In the most recent cohorts, 83% or 4 out of 5 patients are responding to treatment. The level of the drug in the blood is pretty predictable and supports once-a-week dosing. We're continuing to evaluate AMG 701 in patients moving forward. These are the disclosures of the investigators, and we want to thank all the patients, the caregivers, the investigators, and the site staff who participated in the study and made it a great success. Thank you.